All right, and basically that is what we'll be focusing on today's episode of My Doctor. So how are you doing this morning? Thank you very much for joining us. This is My Doctor and my name is Winnie Lubembe, and as you've seen, our topic of discussion today is mental health in children. And we all know, according to WHO, 10 to 20% of children and adolescents experience mental health disorder. And what's sad is that most of them actually go undiagnosed until when it's too late, all right? Or even until when they are teenagers or adults. So the biggest question is why? Or what is it, or why is it that then most of the time the parents or the people around the children are not able to notice some of these signs and get them treatment as soon as possible? And what could happen in the event that treatment is delayed? So that is the subject of discussion today. If you want to contribute in any way or form, then feel free to engage with us. Our SMS line is open. That is 40920. We look forward to hear from you. Send us your question, your comment about the same. And yes, we look forward to hear from you. But before then, my guest is already here, and let's get to meet her. Good morning.
Good morning.
It's good to see you. Welcome.
Pleasure.
Once again to the show. You look lovely.
Thank you.
And let's just start with, no, before we even get to the topic of discussion, I was about to say, wait, listen, mental health in children, people are like, but these are kids, what do they know, about life?
Yeah.
Because most of the time we associate mental health with one of the things is stress, depression. Some people would say this person is crazy, or they're not able to handle their own problems. So really we have like negative connotations, towards it. But before we get into that and all the discussion surrounding children's mental health, and is there such a thing, as mental health in children? Kindly say hi to the lovely audience and tell them who you are.
Hi, my name is Mildred Adhiambo. I am a medical psychologist by training and also a psychosocial trainer. I practice at Kipepeo Training Consultants, which is at Jabavu Lane, that's in Hurlingham, Block 2B.
All right.
Yeah,
Okay. And when it comes to like mental health and experts, like there's so many names and terms, psychosocial, psychologist, counselor, like it's a lot. But anyway, that's besides the point. Point is there are mental health experts out there in the event that someone needs help, because most of the time people are like, so who do we go to see and what happens there? But back to the basics, children, and mental health really in children. Most of the time, like I said, we associate mental health with like negative aspects towards the same. So really, when it comes to children, we think, but they're too young. I mean, really, what do they know about life? Yeah. Why would you say a child is stressed or has depression or any other mental, illness that associates with the same? So mental health in children, what exactly do we mean? And is there such a thing so that people understand? Yeah.
Okay, I think we could start with like basic definitions. For example, who is a child? So a child, during this discussion, we're referring to anyone who is below the age of 18.
Yes.
Yeah. And then according to WHO, the definition of health, it's just like a complete state of physical, mental, and social well-being. So it's not just the absence of disease, for example. So yeah, just general well-being. So when we come to the definition of mental health, what exactly is mental health? So mental health is a state of well-being where the individual recognizes and realizes their abilities. They're able to be productive and fruitful in all that they do. And then they're able to handle the normal stresses of life. So that is the definition of mental health.
Yeah. When you talk about able to handle things that happen in life, some might say, but that's relative. Because you see, there's some people who are able to cope very well, and especially in the toughest circumstance. But some people who are not able to cope, even if it's something small, or most of us would consider small or trivial, to them it's like this big thing, and they're not able to cope with the same. So when we talk about coping, but it's okay, because we're all different. We cannot be the same. And for the children, again, I want to assume that's the same case, because we have children, some who are able to handle some of the things that happen in their life as they grow up, and some are not able to. So is it more on parenting, or is it more on, the differences in people and children and personalities that, these kids are able to cope with things better than the others?
Yeah. So when it comes to mental health, it's not just basically just exclusively the upbringing of a child, but other factors as well. So we have like the biopsychosocial model where we look at the three aspects or different things within the three things that will contribute to whether a child is overall doing well, or they could like now have mental health issues.
Okay.
So that's the biopsychosocial model. So we could go to things like genetics. For example, if there's history of mental illness in your family, personality differences, and then also parental styles, how they are brought up, the kind of environment that they are brought up in, the kind of situations they're exposed to from the time they are kids. Yeah, and then also nutrition, things that they eat when they are growing up. There are some that contribute to like brain development, among other things, that will contribute to the overall well-being of a child.
Yeah. Okay. It's important, especially for the nutrition, really, especially when they're still growing up. They are developing. So again, brain, one of the things that's still developing. So if you do not feed them, again, with the things that will help in the development of the same, chances are they might have issues later. Which I think is one of the things that probably we don't think about it, most of the time. We just like see they're fed, you know, and that's it, you know, but we don't focus on nutrition, which I think we'll focus about later on, and how then this contributes to like mental illnesses, especially in children.
Yeah.
So at what age are children mostly diagnosed with mental illness? Because like I said, sometimes parents might think that their child are okay, but really they are not, you know. So when it's like the most common age that some of these illnesses are diagnosed in children?
Well, it depends with the kind of illness we are talking about, because the symptoms are apparent by different ages. Like, for example, when we talk about autism spectrum disorders, the symptoms are apparent by the age of 3. When we talk about things like ADHD, attention deficit hyperactivity disorder, symptoms are apparent between the ages of 7 and 12. So it really depends with the age of the child, or even like mood disorders are diagnosed in the early, mid to late teens. So it depends with the age.
All right, and we'll talk about then some of the things that we need to look at, and the role of pediatrician as well in diagnosing some of this, or bringing out some of the symptoms, which I think people should be aware of, so that treatment is administered earlier as compared to waiting until teenagers or even, you know, adults, you know, that is when we notice some of these things. And in terms of then some of the common mental health illnesses, aside from ADHD, what else do we know? Autism, you know, in children. Are there other mental illnesses that are most common in children? And do they outgrow them, especially when they are in their teenagehood and then adulthood?
Well, it depends, because sometimes different behaviors can be, you could think that they're mental illness related, but in real sense, the child is just developing, you know. So it depends with like the different developmental milestones of the child. Yeah, so we can have, if I could start maybe from the time they're young, things like autism, and then you also have communication disorders, especially social communication disorder, where the child is not able to adequately express themselves, and yet we expect that by the time they're at that age, they're able to like maybe say a few words, among other things. There's also learning disabilities or specific learning disorders. For example, when the child is not able to make calculations, and we expect that by the time maybe they're at that age, they should be making like maybe 1 + 1, 2 + 2, or they're able to count up to 10.
What age specifically, so the parents know? You know, this could be it.
Like we'd expect maybe a 2-year-old is able to count between 1 and 10. But you know, children are different.
They're different,
so I cannot like give a specific timeline where they're able to do that, you know. But when you find like maybe, for example, a 6-year-old who is not able to like make a 1 + 1 calculation, then you'd have reason to worry. So there's the learning disabilities where the child is unable to like read, write, or even make calculations. Then we can have ADHD. There's also PTSD in children. And then when you come to adolescent, the adolescent age, we could have eating disorders. For example, bulimia, anorexia, binge eating disorders. We could have alcohol use or substance use disorders during the teenagehood. We could have mood disorders like depression, bipolar, and then also schizophrenia or other psychotic disorders that are usually diagnosed during the late teens. So there are like a variety of disorders depending on age.
Different children. But then again, and especially the ones that affect mostly teenagers, or it's more you know, pronounced in teenagehood. This I want to believe it's very difficult to point out, because teens will always be teens, you know, and parents are like, ooh, too, the adolescent, you know, or they're just acting out, or they just want attention, but really this child is not okay. They are sick. So then we'll look at how then do we notice that this is not normal, and we need to take them to see maybe a psychologist or a counselor or whoever that's responsible
Yeah.
for the same, because there are a lot. Okay, then. So can we start with the ones that probably affect the children in, let's say, what, between months to around 2 to 3 years? What exactly do we see, and what are some of the symptoms that we should be cautious about and look? But like you said, children are different.
Yeah.
So in general, we're not giving a timeline here, like by 2, they should be
Yeah.
able to do this and this and this. And what are some of the symptoms for the same?
If we were to focus, but maybe between months and by the age of 2,
yeah.
we could look at like the types of attachments that they make with their caregivers. Maybe whether it's insecure, if they're crying too much, if they're overly clingy.
Yeah.
Sometimes it could be normal behavior, but then sometimes also it could be abnormal behavior.
Okay.
And then inability to communicate. We'd expect that maybe a child by the age of 8-9 months is able to like say mom or make the mama, you know, like the syllables. Yeah. Then if also they have like repetitive and restrictive movement, like for example banging their heads continuously, then that could be maybe an autism spectrum disorder. Yeah. So if you notice that maybe if you're a bit skeptical, you don't think it's normal, it would be important to ask. But then again, do not compare, because children are very different. That's also the other issue.
We do that a lot.
Comparing.
You know, and because I know of some people who say, yeah, my child is like what, 2, and they're able to do 1, 2, 3, 4, 5, and this other one is not able to do almost like 3/4 of this, what this other child could do. But forgetting that, again, like you said, we are different. Children grow at different paces, but there's that general rule where by this particular age, a child should be able to do 1, 2, 3, 4, 5. Okay, all right. But then again, so is this the role of genes then? Can we talk about that so that parents know that, well, it's not their fault, or it's not like my child is sick. This is just genetics, you know, playing a role in the same, and especially in their developmental growth.
Yeah, if you notice that maybe in your family there's history of different genetic conditions, like for example, autism is hereditary, you know. So yeah, don't blame yourself, because it's something that is expected, that is normal, you know. And then also there's the aspect of gene testing, which is also a bit expensive, you know, especially in our country. But it would be important also to like, when you're pregnant, for example, you go for that test, and then now they're able to like look at the different markers for the different genetic conditions, so that you're prepared and you're told what like the specific things to look at that could show that maybe your child has a specific genetic condition. Yeah.
Can couples do that before getting a child?
Yeah, definitely.
I know, because there's a lot of preparation that, I mean, one of the gynecologists was telling us, you need to prepare for pregnancy. Okay, for most people that doesn't happen, because one time you realize, hi, I'm pregnant. You know, so really before you get to do a lot of tests. But they're saying you need to prepare for pregnancy. So ensure that, you know, the uterus is okay, everything else is okay. So they can also do that test before getting a child. Very expensive. To those who can afford, there's a test you can do. It's fine. Okay, then. And then for stress, and I know for most people, especially when a child cries for a long period of time, one might assume that, well, they're looking for attention, or two, there could be something wrong. Maybe the diaper is full and or they're irritated, they're too hot, they're too cold, all those things. But then again, when they're crying for a long period of time, what could that indicate? Aside from medical, like any other condition, you know, that might be suffering from, as far as mental health, could that be like a red flag for parents?
Definitely, because you know, the child is not able to adequately communicate. They're not able to like use words because their communication skills are still growing. So when you notice that a child is crying for a long period of time, it would be important to like try and find out why. Are they hungry? Are they uncomfortable? Is it do they need a diaper change? You know, or aren't you giving them enough attention? Because that could also be like a different thing. That kids are kids and they need attention. So if you're not adequately giving them attention, the type of attachment you're developing with them could actually have like a longer lasting impact, even later in life. I
was reading, I was listening to one of the psychologists who was saying this. If there are aspects where parents contribute to mental illnesses in children, and one of them was saying the aspect of a child that's crying for too long, and they're saying some parents choose not to pick them up, thinking that they're teaching them to be independent, and so to some it works, but to some that again contributes to that aspect of, I don't know if it was anxiety disorder in children, or does that, so they have like some sort of separation anxiety, you know, and all those things. So now you talk about it, I'm like, yeah, Could be,
Yeah.
you know, which I think is one of the things that most parents probably do. Like a child is crying for a long period of time. We're trying to teach them, they need to adapt. We're busy. So really, and especially right now when parents are working from home, they have to work, but at the same time tend to the child.
Yeah.
So it can be, but find a balance.
Definitely,
For
yeah.
the same. So how long is too long then?
How
You know, as far as, it's not like they have, it's not like they're hungry. It's not like the diaper is full. It's not like they are too hot or too cold, but there's a problem. And, you know, since we're focusing on mental health today, it could be, you know, one of the signs or red flags for mental health. So how long is too long?
Well, I don't think I can give like a specific timeline, but I think you as the mother, you know best, or you as the parent, you know best, you know. So when they're crying, that means that there's a need that has been that hasn't been met yet, you know. So for example, if they want attention, it wouldn't hurt to like take 2 minutes and talk to them, you know, just ask them what's wrong, what do you want, what do you need from me. Then after that, you're able to like go back to work, or maybe they're idle, give them something to do. It could be like maybe a game, a board game, or the puzzle pieces or something. Yeah, just give them something to do, but now do not ignore them, because now when you ignore them, it's like you're reinforcing like a pattern of behavior that even later in life they might actually end up being very avoidant in intimate relationships, you know, because that is how they learned to be when they were growing up. Yeah.
Okay, all right, don't ignore.
Yeah.
But then again, don't fall into that trap, because again, when you're always close like all the time, again, it would have an impact, you know, later in life where they're too clingy.
Yeah.
Right?
Okay, too clingy.
Yeah.
But then that would, if I were to ask that, how close is too close? That would be the other
That's
question.
the thing, yeah.
You know.
So
Just find the balance.
Find a balance.
Where you're
Find a
not
balance.
ignoring them,
Okay.
and you're meeting them. You're meeting their emotional needs.
Okay, at the same time.
Yeah.
Okay. And in terms of then, for the same causes, I know we talked about an aspect of genetics which could play a role, but aside from that, what again?
What other causes?
Yes, illness in children. Because like I said, we might think, but you're too young, you know? Or have you heard a teenager said, I am stressed, and then someone is like, how old are you? Like 40 or like, you know? So we think they're too young to have like some of those things, and especially mental illness being one of them.
Yeah.
So aside from that,
genetics.
play a role, but what other thing could end up causing mental illness in children?
Well, biologically, we could have like the imbalance in neurotransmitters, or when the hormones are not adequately regulated. For example, like for teenagers, when they are growing up during puberty, there's the hormonal changes and the physical changes that might actually come with stress. You know that now your body is changing. You're not, maybe you're an early bloomer, so you're trying to hide, you know, or even like emotionally, like the hormones are not balanced. They're not like, they're still trying to find the balance. So that could also lead to like mood changes when you're growing up. And then you could also have, like, for example, if you had an overly critical parent, so you have low self-esteem, poor body image, among other things. Then also during teenagehood is when they're trying to like find their sexual identity. So if they're queer, for example, and then they end up getting rejection from their parents and their peers, you know, that could also lead to mental health issues. You could have bullying in school. You know, when they're being bullied, that could also lead to mental health issues. So it's like biopsychosocial. You yourself, your environment, and even the biological aspect
plays a role as well. Okay, we have like 3 minutes to go on break. So in terms of some of this, we talked about some of the symptoms when they're way younger, you know, like crying and all those things. But then again, in preteens can we talk about like from 5, because again, there's mental illnesses sometimes which are diagnosed at that particular age, between age 5. So let's talk about between age 5 and 10 very briefly. Some of the things or how the children will react that might tell that this child could have any form of mental illness.
I think with any child, just be very attentive. You know, if you notice that maybe there's a sudden change in behavior, that maybe they were very social or very outgoing, and then all of a sudden they've withdrawn, that could be a problem. You know, if maybe there's changes in how they're eating or even how they're sleeping, that could indicate that there's a problem. If they're getting anger outbursts or they're extremely irritable, that could also be a problem or a cry for help. And then also with ADHD, sometimes even like in the African context, we expect, for example, boys to be very hyperactive. You know, it could be ADHD, but in real sense, you think that, you know, that's just a boy being a boy, you know, and that is actually a cry for help. That child needs help, so they're able to like sit still, be attentive in class, and also perform well in school. So the objective is to be very attentive. And then if you notice any behavior change, any personality difference, any mood change, then yeah, you could ask around or just continue to observe. If it continues to persist, and then it's causing significant distress either to the child or those around him, then yeah, you need to get help.
Yeah, you need to get help as soon as possible. Because I think that's the thing. Most of us wait
Yeah.
and think, oh, well, I mean, they're just kids or they're just teenagers, but really there's a problem that needs help as soon as possible. Okay, so let's take that short break. But when we come back, I know the aspect of being attentive can be difficult for many parents because they have to work, you know, probably some parents spend long hours in the office, and then by the time they come home, the child is asleep. They leave when the child is asleep. So really, we don't know our children very well. But right now with COVID, at least most people are at home, so we can, you know, learn a few things from our children. But we'll also talk about how then COVID has affected children. Because like I said, we think, but they don't understand what's going on, but really they do. This could also put a little bit or much stress to them as well. So we can talk about then how this affects them. But if you have any other question, feel free to send us an SMS on 40920. Would love to hear from you and read your questions as well. But for now, we're taking a very short break. See you right after. Glad you're still with us. This is My Doctor. And our focus today is on children's mental health. So if you have any other question in relation to the same, feel free to send us a text message on 40920. We'll look forward to hear from you. But aside from that, or before that, before we look at your questions, that aspect of COVID-19 right now, I know children know it as, you know, Mtahikagu's disease, you know, COVID, okay? But for most parents, having this discussion with the children, some assume that, well, but they don't understand, you know, they don't know. They are at home, some are happy to be at home, others are like, can we go back to school, you know, and they don't understand why they're not in school. So in what form, or let's just say pandemics in general, how then do they affect the children? Because most of the time parents think, oh, well, but it's us who feel the brunt. We're not going to work, or we're not employed anymore. We've lost, I mean, our businesses have closed. And so really it's us to take the stress, but really even the children are stressed about it. So then how can this affect them really in general now or even in their adulthood?
Well, I think the notion that, you know, kids do not have like a role to play in this pandemic, I think it's a wrong one, because at the end of the day, they're also part of like the transmission process. True. So it would be important to like just communicate to them and tell them what is going on, why they are at home and they cannot go to school, the importance of not just being with their friends the whole day, you know, playing, you know, putting on a mask, among other things. So it would be important to communicate to them. And then, you know, like we learn through observation, right? So even like in the house setting, and then they're seeing like their parents panicking or just focusing too much on like news on what is happening with regard to the pandemic, how many people are dying, how bad it is and all. So they could like absorb those energies, if for lack of a better word. They could absorb the energies, and then now when they go outside, there's also the aspect of misinformation, you know, because they're getting information from their peers, also getting from people who are not as informed as we'd want them to be. You know. So it would be important to like give them the correct information, number one. You ensure that even your information sources are very credible, either from the WHO sites or credible government sources. And then like tell them not to panic, you know, just explain to them in age specific or age appropriate language, using examples that would make sense to them, because, you know, still their communication skills are growing. So you explain to them the importance of like protecting themselves, what COVID-19 is, you know, why they do not have to be in school, why they have to stay at home for a longer period of time and not go out and play with their friends. It's just to ensure that you're on the same page, and then they're not getting misinformed.
And why they have to wear masks, because some of them are like, really now what's this and why do we have to wear
this? Or even hand washing, you know.
And even from the numbers and statistics that we get on a daily basis, we also see that young children, you know, young as 2 months, 7 months, you know, are also dying from the same. So that aspect of fear, you know, among the children, because they're like, okay, so we can also die from the same. And cause anxiety among them as well. So in terms of then ensuring that we give them age-appropriate information, but then the how can be very difficult. You know, for instance, if the whole family is watching TV and then they hear the CS or whoever is giving the update saying, so among those who died is a 2-month-old baby, you know, like that's terrifying to us adults, so we can imagine the children. You know, so in terms of passing the correct information, but then again, the how, so that we do not again instill fear, which again, over time might, end up developing anxiety disorder of some sort.
You could start with what they know. So just asking them that, what do you think about, have you heard about maybe, for example, COVID-19? Do you know what it is? Or what do you think it is? And then so if they tell you whatever it is, and then you feel like you need to like correct a bit of information, you correct it, and then I'll tell them to like say it back to you according to how they've understood it. You know. Then also encourage them to like ask questions, like, do you have any question for me with regards to like COVID-19 or what you get to hear daily? Yeah.
Okay. Now let's get back to parenting, which most of the things stems back to parenting. And it's very easy for us as a society to point fingers at the parent, and especially when it comes to like children, how they are raised and how they behave, It's very easy for us to blame the parent, be like, yeah, this is poor parenting, or yeah, they did not spend enough time with the children, that is why the children are acting out, or this or that. So as far as parenting is concerned and what role it plays in preventing, I would say, cases of mental health. And I know there's no like correct parenting and not correct parenting. Everybody learns through the process. But as far as the basics is concerned in ensuring that then again the children grow up in a safe environment and grow up to be, let's say, responsible people, which again will help them in communicating with other people and socializing with other people without necessarily being deemed as this is not a good child, they're behaving badly, or they're doing this or they're doing that, and then ends up having like mental illnesses later on because of rejection from other people. What would you say?
Well, parenting is an important factor, and it's also like a very important determinant of whether the individual develops mental health issues or not. Yeah. So I think even as a parent, like you should be very self-aware and self-critical. Like just try to understand why you parent the way you do. So I think I could give like an example of like the overly critical or over-involved parenting, where you're like a hawk, you're trying to like overshadow your kid. Yes, it might come from a very good point, that you're trying to prevent them from harm, among other things. But now, in real sense, you're not encouraging, like, creativity.
Yes.
You're not encouraging autonomy or independence in the child, because it would be important, like, for the child to be independent. You're not going to be with them the whole time.
Sure.
That even when they go to school, they're able to be autonomous and also, like, engage in new activities,
as well,
So when you're constantly over-involved or over-protective, they might develop this behavior where they try to like avoid new situations, that could lead to anxiety later in life. Because, and then also,
they don't know how.
They do not know how. And then they
it.
also don't get to like realize that they're able to cope even in a new environment that is potentially fearful or potentially hard. So you shouldn't be like overly over-involved or over-critical. And also being a very critical parent where you're constantly criticizing your child and not and minimizing their emotions. That do not cry, big boys do not cry, among other things. You might end up having like a child who is depressed, for example, who has symptoms of depression later in life because they are very avoidant of emotions. And they do not want to like be in touch with their emotions, among other things.
Okay. And then talking about this, that reminded me. You see, being raised with an African parent, most people are like, I don't know if I told you this or it was someone else who was saying, all of us who've been raised with African parents, if we survived,
we can survive anywhere.
Anywhere, because, they're very harsh and all, which to some extent, helped shape the way people are. But then again, on this other end, people are like, some of the things that, like from what you said, you're scared to try new things because, again, you do not know. Your parent will, or yelling. There was a lot of yelling, I can say, in other people's or in other families, which, again, some people say, too much yelling, again, might end up causing, like, other mental illnesses in a child, or even those who are overly critical, again, of their children. So then how do we find the balance? Because at the end of the day, you want to be a parent, but you also want to be a friend, but you also want to, so finding that balance, because again, if you let them loose, and children are very smart, like you said, children learn by observing. You let them loose and, they lose it completely. So then how do we find that balance and just ensuring that we raise our children in one safe, but then again, don't allow them to do whatever they want because we want them to be safe and have everything that they want.
I think that's like you're basically describing the authoritative type of parenting, you know,
yes.
where there are clear expectations, boundaries and limits.
Yeah.
And then the child knows that if you cross this boundary, there's a consequence, you know. And at the same time, you're also encouraging you're very responsive with regard to emotion, that you're telling them that all emotion is important and it is very normal. You know, it is normal for you to be angry, to feel sad, to feel frustrated, but how you express the emotion is the important bit, you know. So even when you're correcting them, try and be as calm as possible. Do not yell, because now when you're yelling, you're encouraging them or you're teaching them that it is okay to be aggressive, especially if you're frustrated or if you do not get what you want. So now you're likely to find a child who will hit other children, especially if they do not get what they want, because you know that it is normal that when you're frustrated, you can actually cause harm or pain in someone else, because that is normal. I saw my parent do it. Yeah, so yelling is not the point. Also, you try to be in touch with your emotions, be calm, and then now when you're explaining to them, tell them that you're getting punished because of you did 1, 2, 3, which is wrong. And then instead of focusing or just waiting to punish them, also teach them what or how to be, you know. So also encourage them, like for example, other virtues, especially now that they're at home. You could have like virtue of the week. Say that this week you're going to deal with kindness. Explain to them with regard to like age appropriate language and examples. Yeah, we're back to that. You explain to them what kindness is, what different acts of kindness are, and then when they perform it, also reinforce and tell them, you know what, good job that you have done that. Recognize also the good in them, you know, because like you'd find someone who is depressed, they just tend to focus more on the negative than the positive, you know, because that is behavior that has been reinforced from the time they were growing up.
And again, it's interesting right now that parents can sit down with the children and talk, as compared to when we were growing up. You try to talk to it. It is a good thing. I actually say, you know what, how we were raised really has helped shape so many people, because compared to, I'm not saying the children right now are really bad, but there was that fear of God when you were growing up. You do something, you know you're in trouble. And anyway, so it's different for different people. The way you raise a child, I mean, it's not the same. Like I said, most of us have probably the older people would say, yeah, our parents did so well in raising us in the way they did, you know, with but then again, to some people, they were like, no, I cannot raise my child, you know, the way I was raised. So it's different. Like we said, parenting is different for different people. Now, for that aspect of, fine, this child has been raised in a safe environment and all those things. And sadly, there are children who do not get that. And especially right now with COVID-19, we've had a lot of cases of violence. You know, against women, against children, as well. There's that aspect of, again, abuse. You know, some children are actually molested. I mean, and especially with the people who are really close to them, who are supposed to, again, offer them safety, security, shelter, all those things. So then how can this affect a person, and especially when it comes to mental health? And what are some of the telltale signs? I mean, we all know sometimes they withdraw. They do not talk about it because there's that aspect of threats. You say it, you die, you know, or I'll do something bad. So then that aspect of how can this affect someone, maybe not now, or they might not be able to show it now, but later on in life as they grow up. Some of these things, so what could it lead to?
Yeah, exposure to physical, verbal, or sexual violence is actually a key determinant of mental health issues, both in childhood and even later in life, especially when they're exposed to more traumatic events. And this could even be as early as 1 year for a child who's 1 year old, you know. Like the caregivers or their parents are a source of comfort and safety, you know. And a traumatic event, even just by definition, is when there's a threat to your safety. So for example, if you lose a parent or a caregiver through death, abandonment, or even there's incidences of physical violence, you know, or sexual violence in that house, or even substance use, it could lead to like mental illness either during the childhood, adolescence, and even later in life. So the kind of environment one grows in is very important, and it's a key determinant in whether you develop or not. And even your coping strategies, among other things.
That's a big thing, coping. Because again, like I said, most of us are not able to cope well. Other people are able to cope well. So it's a big determinant. All right then. So in terms of diagnosis, what is the process like? Diagnosing, you know, mental illness in children and even in teenagers and probably adults, the young adults. Yeah, because it can be difficult, because I'm imagining a child not able to talk, not able to say what they're going through, express themselves, express their feelings, and even for teenagers, that aspect of shame and guilt and self-esteem and anger, you know, so they're not able to really express what's going on. So how do you then diagnose?
Okay.
Yes.
Yeah, for kids who are unable to talk, we mostly rely on direct observations, just observing the kid. And then it would be important to like have a multidimensional team, you know, where we have like the GP, not just mental health experts, because other symptoms, could be as a result of different medical conditions, you know, like autoimmune diseases and other infections. So it would be important to like work in a team. Yeah, and then so there's the direct observations, and then we'll also ask for history from like the caregiver, the direct caregiver or family members. Then for school-going children, it would also be important to like engage the teachers and ask them how they're behaving in school, because sometimes a kid could behave completely differently in school and at home.
Had a lot.
So we'd want to like get the full picture, you know, this is how they behave in the house, and then it is also consistent with how they behave in school. Then we could say that there is a problem. But if they behave just a certain way in the house and not in school, then maybe they're just trying to seek attention, or they're trying to like express a need that has not been met in the house. Yeah, so there's observation and then asking for information and feedback from people around the kid. Yeah.
How long is that process like? Because, and I know there's not specific time frame for the same.
Yeah.
But in general, or is it dependent on, let's say, the severity of the mental illness? And again, how willing this person or child, teenager is you know, as far as giving information. Is that dependent on those two?
Yeah, definitely. Because for you to come up with a correct diagnosis, you have to like have the correct information. So for example, if they're not as generous with information as possible, then you're likely to either misdiagnose or have a condition that goes undiagnosed, you know. So that those are among the barriers that we expect. And even for like teenagers, they tend to be very secretive, you know, that they're not very forthcoming with whatever is happening, or they could lie, like manipulative behavior especially is common with people who have like substance use issues. So it is important to like get the correct information for you to have like the correct diagnosis. Then you can have like a correct plan on how to for the different interventions
that needs to be done. And before we get to interventions then, so for parents, the approach, because again, parents being parents will be like, yes, so I am the parent and I say you need to go see a counselor, psychologist, go for therapy, and you have to. You know, like there's no two way about it. And this child is like, no, I do not want to, you know. So that aspect of the approach, like what is the correct approach for parents as far as mental illness is concerned, and trying to seek help for the children? What is the correct approach? So that then we do not push them further into either if it's depression, anxiety, or when they just try to seclude themselves and not talk and do anything, we push them further towards that direction.
Yeah, with mental health now, those are among the barriers, you know, that sometimes we could force someone because you as like the observer, you see that this person clearly needs help, but according to them, they're okay.
Don't have a problem.
They do not need help, or they think that they're able to like handle or cope with whatever is happening, you know. So I think it boils down to communication, how you communicate with them. So instead of telling them or seeming like you're the one in control, like just give them options or talk to them and ask them, how do you think you're doing, you know, with regard to how you are behaving maybe a year ago, 2 years ago, do you think there's a difference? Is it affecting how you, for example, do things, you know? Are you able to do things that you used to do? Do you find joy in the things that you used to find joy in, you know? Then you could also engage their friends, you know? So it's also important to like have a sort of relationship with the friends of your kids, you know, because even they're able to like give you information that you're not able to like see, you know, like for example, if you do not know, or when they're involved in like self-harm behaviors, like for example, cutting, a friend could notice, and then maybe you as a parent, you haven't noticed. So they could come and tell you that I have noticed 1, 2, 3 in them. And so it's a matter of seeking feedback from those around them, and then working with them from where they're at. You know, do not try to like tell them, I want you to be 1, 2, 3. Work with them with like set goals with regard to like their capabilities, talents, and interests. Because sometimes it's easy to be like, you're not behaving this way, and look at your peers, the way they are or what they're doing. It's it's a lot for the child as well. But I also try to explain to them why it's important that they need help, right? Because most of them will be like, but why are you taking me to see someone else, and I have to express how I feel to someone else? I am not too sure I want to do that because
it's embarrassing, you know, and all those things, but try to explain to them why it's important.
Yeah.
They need help. Now, so the big challenge then comes into getting them there,
Yeah.
and especially for teenagers. Because again, sometimes, especially those who do not want to admit that they have a problem or don't even know that they have a problem, because some think I am okay, I do not see anything wrong with me. Why do you want me to go and seek help? So then that aspect of getting them there, that is where the problem is. What is the correct approach again for the same? Or just take them and drop them there?
I think it's important to like just communicate and ensure that you're on the same page. You know, you could even like try and bribe them and tell them that, you know what, I want you to do this, you know, and then I'll give you something in return, you know.
Okay.
But no, don't make it a habit, because now they'll get used to the fact that they have to behave a certain way. Yeah. So you could try that, communicate with them, and then also tell them that, you know, try 2 sessions and then see. If you're getting better, then fine, you can continue. If not, then don't.
Okay.
Yeah.
All right, and let's look at then the various treatment options for mental illness, and especially in children. Is it then dependent on the age or, age, maybe the type of illness they are suffering from, and the severity of the same?
Yeah, definitely. So they are age dependent, and then with regard to how much, like the level of distress it's causing the person. Okay. So there are different treatment interventions. You could start with the first one, medication. There's medication for different conditions, especially if maybe it's an infection or an underlying medical condition that is causing the symptoms. It would be important to rule them out. Yeah. And then also for like ADHD, we have different medication that would help the child to like just calm down and also improve attentiveness. Then you also have like the non-medical interventions or non-medication interventions, like for example CBT, that's cognitive behavioral therapy. We have art therapy, we have interpersonal therapy, there's also occupational therapy, especially for children with autistic spectrum disorders. So they are trained in like motor skills, and then how to communicate, because now for them communication is actually a problem. And then now when they are not able to communicate, they're likely to like throw tantrums because they're trying to pass a message across that is not being received. So occupational therapy is also an intervention that can work. So they are different depending on like the age, the condition, and then also the severity of the symptoms.
And for interpersonal, then what happens during the, you know, in terms of that type of treatment, what usually happens with the same? And how long does it take?
Well, I cannot give like a specific time frame. It also depends on like the symptoms and also how the person responds to the treatment. That's also another factor, you know. So it's a matter of like just recognizing the patterns of behavior and then now finding ways of like removing the unwanted behavior and also reinforcing the behavior that you want. So some interventions could like be linking like your thoughts and like your thinking patterns and how they make you feel and how they make you behave also in turn. So it's a matter of like just coming, getting the client, and then understanding what the problem is, the cause of the problem, and then now setting goals, and then now setting appropriate interventions for the same. And then it is also important to involve like the family, because now after they leave your office, they're definitely going back somewhere. So it would be important to like tell the family that these are the warning signs, these are the things you should look out for when this happens. Either call me or take them to a hospital for further support.
Because again, if you do not, and then this parent probably or caregiver does not know how to handle this person, it becomes a problem. Because I was reading somewhere, I don't know, I can't remember who was telling this, but again, there's that example I gave earlier on of a child who again had autism, and then I think theirs was very severe that they had to be taken into a center, and they will be okay there. But once they got home, they would be very violent, and they would destroy almost everything in the house. And the parents were very, very frustrated. So I'm thinking for other mental illnesses as well, does it ever get to a point where they have to be taken to a specific center for them to be attended to there, and then probably after some time when they feel better, then they'll be taken back home?
Yeah, definitely. Depends with the severity of the symptoms. If they're not able to like handle the home environment adequately, then the best thing would be to take them somewhere where they're able to get help, and then now come up with like a method of how they, like it's like a return to home formula, you know, where you do it like slowly, not just abruptly, because sometimes we're not able to like adequately handle change. So it would be important to like just introduce a different environment gradually.
Altogether. But then again, and what if probably the source or the cause of their illness, mental illness, was at home? You know, it's not safe, it's not, something happened in, let's say, that particular home, that they feel safer somewhere else than at home. So then in terms of getting them back home, could be a challenge because now they don't want to go home. I am okay on this other end. I do not want to come back home. Is that when then you have to involve the parents and talk to them and tell them probably this is the reason and something has to be done?
Yeah, like I said earlier, when you're dealing with a child, you definitely have to involve the parent. And then also for like school-going kids, you might realize that maybe they're just getting sick or they're having like constant stomach aches and headaches. But when you take them to a hospital, everything is okay. You know, like all the tests are good, every system is okay, but they still they still have the symptoms. So now as a GP, when you have such a case, you need to like talk to the parents and ask them, or even just ask them in and see how they relate. So it could be maybe there's incidences of violence in the house or maybe abuse in the house that is causing the child to like develop the symptoms. And they're not really sick, but they still have like the symptoms. Yeah, so the environment is definitely important in how the kids,
because I'm trying to imagine, so how then do you get this person to go back home and expect them to feel safe and grow normally and just be like a normal child? It could be really difficult. But again, involve the parents and find a way of this, even if they would have to have like a counselor, therapist, or psychologist over to somewhat, or maybe have like a group therapy, because I've seen people do that.
Family therapy.
Again, yes, family therapy, where they would probably sit and the child would say what they're feeling, and especially about the parents, just like a let out, you know, and then they're cool and then they go back home.
Yeah, family therapy is something that you should definitely incorporate into your treatment plan, because at the end of the day, this child is going back somewhere. You know that you're not going to stay with them in the office or in the hospital setting where they are, you know. So involve the family and then find out like the home environment, how it is. Is it really conducive for the development of this child? Are there incidences of maybe one of the parents coming home drunk? You know, that could also be like another contributor. Yeah.
Okay. And then for coping mechanism, because like it said, and you talked about this earlier, where people are different in terms of how we cope with things in life, really. But as far as, and especially for someone who probably had mental illness when they were younger, first of all, do they like get over it when they grow up and become okay and it doesn't affect them anymore? And for those who do not, if they do not, coping mechanism then, because you say life has to go on, you have to interact with people, you have to go to work. For those who want families, you know, you'd have to have a family at some point. But then again, if you can't cope well, then it becomes a problem. You create another problem in all these areas then. So in terms of coping, and especially those with mental illness, what would you say?
Well, most mental illnesses are actually chronic, so that means that they'll be with you for a long time, you know, just basically your whole life. So it's a matter of like just identifying the triggers, you know, minimizing stress, and then now identifying adequate coping mechanisms, so that in case maybe you're going through a stressful situation, that you cope adequately, so that you don't go to a point where now you need to be admitted, for example.
Okay. So learn your triggers.
Learn your triggers. And then also communication. Communication is something that we ignore, but it is very important. You know, ensure that maybe there are consistent relationships. Ensure that you have like a very productive relationship with your child, so that in case of anything, they're able to like come back and talk to you. Mutual respect, understanding, affirm them, you know, just telling them, you know what, I'm proud of you, you're doing a good job, you know, that could also like contribute to like their mental health.
Okay. And it's team.
Yeah,
especially in
esteem,
definitely. That is where there's a problem.
Yeah.
All right, and we have to end the show on that note.
Okay.
Thank you very much, Mildred, for coming by. Really
Thank
appreciate your time and helping us understand how important, first of all, children's mental health is, and what we can do as parents, as a society, to help these young ones grow in a safe and, I would say, peaceful environment that, again, will help them in their growth, and eventually when they are adults, they're able to cope, because coping is like the biggest problem. But thank you for coming, and of course thank you so much for staying with us as well until the end of the show. We believe that you've learned a lot from today's topic, so we have to end it here. My name is Winnie Lubembe. God bless. We'll see you on another episode of My Doctor, but for now, it's a goodbye and stay safe.